Good morning, everyone. My name, sorry, I have a whole bunch of things popping up on my screen now.
Meanwhile, they can put the cameras off again, please, except of Dr. Holloway. Thank you.
Thank you. So good morning, everybody. My name is Morgan Hoffarth, and I am the president of the Registered Nurses Association of Ontario. Joining me is RNAO's Chief Executive Officer, Dr. Doris Grinspun, and our President-elect, Claudette Holloway. Thank you, everybody who has joined our media conference, including members of our board of directors, our assembly of leaders, other RNAO members and reporters. Whether you are part of our meeting or watching the release of our 2022 provincial election platform via our live stream, we welcome you. After we present our platform, we'll take questions from the media. I ask that reporters use the raised hand feature to let us know that you have a question. This way we can put you in the queue, and you can use this feature at any time during the media conference. Before we get to our platform, I want to acknowledge the traditional land on which RNAO resides. We at RNAO recognize that our work and the work of our members takes place on the traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on the traditional and unceded territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of this meeting are located in other traditional lands across Ontario. Today, this land is still the home to many First Nation, Inuit, and Métis peoples from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. RNAO is the professional association for registered nurses, nurse practitioners, and nursing students in Ontario. We advocate for healthy public policy, and that is why we are gathered here today. On June 2nd, Ontarians will cast their vote in a provincial election. Nurses consider the right to vote an immense privilege and a serious responsibility. We represent the largest group of health professionals in the province, and we play a central role in the health of individuals and communities. The election comes at a critical time in Ontario's future. The ongoing COVID-19 pandemic has exposed many inequities and failings in society, in our institutions, and our health system, and it's raised questions about how nurses and healthcare workers can provide even better care with support from the government. In addition to more than 12,000 deaths from COVID-19 itself, thousands of Ontarians lost their lives during the pandemic due to drug overdose, canceled and delayed surgeries or treatments, as well as an inability to access care when needed. Ontario must provide adequate funding, resources, and support to protect our most vulnerable populations at all times, especially during a pandemic. Nurses are the backbone of our health system, and since the onset of COVID-19 over 2 years ago, nurses have been at the forefront of care across all health sectors and in all roles. As nurses, we are keenly aware of the factors influencing and shaping people's health. That's why RNAO is releasing a platform for all political parties to adopt. Our evidence-based recommendations cover 5 key areas: environmental determinants of health, social determinants of health, nursing, care delivery, and fiscal capacity. Titled Ontario's Nursing Crisis, Your Health System, our recommendations are necessary to set Ontario on a path that addresses environmental deterioration, tackles social and economic inequities exposed or aggravated by the pandemic, and thus serves to protect vulnerable populations, and a path that addresses the immense crisis in the nursing profession that has brought about a collapse of our health system. Environmental protection is a matter of health and a matter of social justice and equity. Temperatures are rising faster in Ontario than the global average. Human activity is driving climate change, and uncontrolled urban sprawl is eliminating water sources and productive land. All of these factors diminish nature's capacity to sustain life and impact our health. To confront this, nurses urge all parties to implement a comprehensive plan to meet 2030 greenhouse gas emission target of 60% below the 2005 levels that includes carbon pricing, investment in transit, a green infrastructure fund to support, preserve, and manage the natural environment, and equitable distribution of transition costs and benefits. Nurses also ask parties to commit to report on progress annually. Candidates must recognize that access to clean water is a universal right, yet many Ontarians are without it. That's why we urge all parties to develop a comprehensive water policy to ensure clean, safe water for all Ontarians. During the COVID-19 pandemic, we've witnessed growing social and economic inequities. Housing and health are inextricably linked, yet not everyone has access to affordable housing. And during COVID-19, Ontarians were asked to self-isolate when sick with the virus, but many could not afford the living space needed to do so. That's why nurses urge all parties to invest 1% of Ontario's annual budget in an affordable housing plan that supports rent subsidies and supplements, constructs 10,000 units per year, a creation of an Indigenous-led urban and rural Indigenous housing strategy, development of 3,000 units of supportive housing, and investments to end chronic homelessness by 2026. Currently, 1 in 9 Ontarians do not have a livable income. That's why nurses ask all parties to commit to raise the minimum wage to $17 per hour and make sure that further increases are indexed to inflation. Coupled with an increased minimum wage, no one should have to choose between making a living and looking after their health as well as their family. That's why we also urge all parties to provide 10 permanent sick days for all employees and an additional 14 paid sick days during a public health emergency. Equally important is childcare. The federal government is willing to negotiate an agreement for $10 a day childcare, and yet we're the only province that hasn't signed a deal. Parents need that support. Nurses urge all parties to commit to immediately sign an agreement with the federal government for $10 per day childcare. Before and during the pandemic, RNAO prioritized its advocacy and work with its Indigenous partners. We hope all parties strengthen Ontario's relationship with our Indigenous communities with proper supports and funding. Nurses ask all parties to work with the federal government to ensure all 94 of the Truth and Reconciliation Commission's calls to actions are implemented. Search for unmarked graves on the sites of former residential schools in Ontario, and make permanent the 50 community wellness nurses in Indigenous communities, as well as increasing and sustaining funding and resources to all Indigenous communities to ensure their community-determined public health needs are met. Now, I will welcome Dr. Doris Grinspun, RNAO CEO, to share our recommendation on nursing and the other areas of our platform.
Thank you so very much, Morgan. And I also want to introduce our president-elect, Dr. Claudette Holloway, and our immediate past president, Dr. Angela Cooper-Brathwaite, who I know is here alongside the board of directors and assembly of leaders. Good morning, everybody, and good morning also to the media partners that are with us today and some politicians, I'm sure, before we see them this evening, you are also here. Let me follow on the comments of our president, Morgan Hoffarth, and speak about the crisis in nursing. Our province, as everybody knows by now, is facing a tremendous nursing crisis. And that is why we titled this platform, Ontario's Nursing Crisis, Your Health System. Because it is, when it's a crisis in nursing, the shortages that we are experiencing by extension actually affect every single person in Ontario, whether in health or whether in illness. We entered the pandemic with a shortfall of 22,000 1,000 RNs short per capita, the lowest RN per capita in this nation. Add to it Bill 124. You have heard us speak about it before, which is the Ontario wage restraint legislation, and then add to it a lengthy, more than 2 years pandemic with unprecedented intensity, with fear, with exhaustion, and what you get is a toxic mix. This is what is confronting us now. I will say before I go on that we can solve this crisis. So it's not, we are giving up on it. It is solvable. And that's what we are here to talk today. The result, though, is that nurses, especially RNs, because of the intensity of the pandemic, because of Bill 124, because of workloads, and all that you have heard us speak in the past, have left and continue to leave their jobs, or worse even, at times the profession altogether. Many feel unsupported by government, and they question their employer's support. We need to urgently turn the tide around before it reaches a point of no return. And we can, and we must. We must commit to building nursing careers in Ontario through retention first and recruitment. Nurses urge all parties to commit to retain RNs and NPs, to deal first then with compensation and with workloads, because that is the way for retention. And for that, we ask, yet again, to repeal Bill 124 and to refrain from imposing any further wage restraints, measures on nurses, and in fact, on other public sector workers. And we also ask that we top up the compensation until there is a new collective agreement. Let me comment, because I know media will ask, is it good enough what the Premier did with the $5,000 bonus? We call it a good gesture with good intentions. So we take it for good gesture, and we are asking now for the Premier to repeal Bill 124, and today is the best day. And we also ask that we allow our unions, ONA and other unions, to negotiate fair compensation for nurses of all categories of nursing. Once we deal with the retention of nurses, it will be easy, not only to recruit more, but to retain them, because we have an increased number of people that want to become nurses. So that's the good news today. We want to continue the increased enrollment and corresponding funding in the 4 years baccalaureate program that began in 2021. And we acknowledge that the government did that. It must continue for the foreseeable future. In fact, we are foreseeing that for the next 8 years, we will need to continue the increased enrollment. We ask to compress the length of bridging programs. Bridging programs are those that go from PSW to RPN, from RPN to RN, from RN to nurse practitioner. They need to be compressed. Prior learning assessment in the roles of these individuals needs to be recognized. And we need many more bridging programs with flexibility, because people, many of them, need to continue to work. So they need to be flexible. We also want, as you have heard us, to expedite the application for internationally educated nurses. And I know, Morgan, and I know that many of them are listening to this today. We stand with you. And we need to develop different pathways for these IENs to practice nursing in Ontario. They live in Ontario, over 20,000 of them. Right there, we can solve a lot of the nursing shortage. Let's bring them to work. In addition, RNs must be supported through their career by developing and funding a Return to Nursing Now program to attract RNs back to the nursing workforce. We used to have this program, we need it back. And we need to expand the excellent program that Ontario has on Nursing Graduate Guarantee to also include IENs, internationally educated nurses, and to reinstate the Late Career Nurse Initiative. Again, we had that, we need to bring it back, alongside of bringing back retired nurses to serve as mentors to new recruits. You heard our colleague, Catherine Hoy from ONA, that nurses are overburdened. We know that nurses are overburdened. So for them to mentor newcomers, whether these are new grads from Ontario or where these are internationally educated nurses, we are joining with ONA to call to bring retired nurses. They can come back, paid employees, to mentor the new recruits. To monitor the crisis and make sure it resolves, we also ask that we set up and establish a nursing task force in Ontario. And what a better time, because the government announced that they are going to hire a chief nurse officer. And by the way, a promo, end of the month, you need to put the applications. Well, establish a nursing workforce for that individual with joint provincial nursing community to monitor the progress of all these recommendations and other additional recommendations that may come to play. Addressing Ontario's RN crisis is crucial to avoid a total health system collapse. And we expect candidates from all parties to hear our plea, because whichever is the party that forms the new government, whether it is the current party or another one, will face the same challenges of a nursing crisis, in particular the crisis of RN shortage. All party leaders, and indeed all candidates, must understand that the solutions we are bringing today would resolve the nursing crisis. But the work must start immediately if we are to improve conditions that will retain the current workforce, as well as attract and retain future generations of RNs. Let me repeat, many people want to become RNs. We need to bring them to a place that can also retain them. Nurse practitioners, let's talk about them, are a central solution to ensure faster access to quality health services across all sectors and settings. NPs, as we call them, care has shown improved health outcomes and positive experience for decades. We call on all parties to increase the number of nurse practitioners in Ontario by 50% by 2030. This is not far away. 2030, we want 50% more, and that doesn't even begin to match what the US has. And developing a comprehensive health human resource plan for NPs across all sectors of the health system. We also need for NPs that they should not experience barriers to practice to full scope. We hope that Minister Christine Elliott will announce today that the barriers that NPs are experiencing will be removed immediately. Let's talk now briefly about the learnings from COVID-19 for the care delivery system as a whole. More than 4,200 residents in long-term care die from the COVID-19 virus, as you all know. The sector was essentially abandoned. The sector suffered for many decades from shortfalls, and they really showed their ugly face during the pandemic. It was all the more devastating for families and staff because the sector, as you know, had been underfunded and understaffed for decades. And successive governments knew this. We had brought it to the attention of past government and the current government. During this pandemic, ICUs and emergency departments were stretched beyond capacity. Now we are seeing catastrophic backlogs on surgeries, for example. Primary and home care were often inaccessible, as you know, whether it was because of PPE or because of staffing, when they should have been at the forefront of Ontario's pandemic response. Thus, we must adequately fund, number one, seniors care. And we do believe that long-term care will be the silver lining of the tragedy of this pandemic because investments are being put. But we want more than that. We want to implement a comprehensive seniors care strategy so every senior has timely access to high quality, dignified care, which includes, first of all, home care. So funding needs to be increased so people can remain at home as vibrant members of their communities as long as possible with the support required. And so that when the first visit, for example, in home care should be from an RN, and then that RN can triage to other people. And if and when people need to enter long-term care, and as home care will be better funded for seniors, not as many, hopefully, will feel they need to go to home care. Let's make sure that they get safe and dignified care. How do we do that? Number one, enshrining the RNAO nursing home basic care guarantee legislation to ensure a minimum of 4 work hours of direct nursing and personal care for residents in long-term care, so that care for residents every single day for every single resident is 4 hours of care. And that care should be 20% RN, 25% RPN, and no more than 55% PSW. That was accepted by the commissioner. That was accepted by many others already, our colleagues in ONA included. So let's move with that, both the 4 hours of care and the skill mix required for safe and quality care. And also, people need the knowledge. And as you know, capacity building in nursing homes is a shortfall because of the staffing problems. Therefore, we are asking the Minister of Long-Term Care to embed RNAO's best practice guidelines in the resident's electronic medical record. Just picture when a provider will come, will see, put the name of the residents, and the recommendations based on evidence will come in front of their eyes, how that will improve immediately the care that residents receive, both in terms of safety and quality, and alongside with the staffing in terms of the experience of residents in long-term care. My colleague, our president, Morgan Hoffarth, is a director of care in a nursing home. And she can tell you, because she, of course, the board also were part of shaping these solutions. They can tell you these solutions will work in long-term care. The pandemic also shone a light on public health as the first line of defense when it comes to infectious diseases and when it comes to protection of the public in good times too. Thus, RNAO urges all parties to maintain and extend the current level of public health surge funding to avoid risking Ontarians' health. This pandemic is not over. Many of us follow the epidemics of this pandemic. This pandemic, it's not over. We need to keep our vigilance, and we need to keep it also on other aspects, like, for example, the opioids crisis. Making permanent the 625 public health nurse positions that we put in our schools during the pandemic is something that needs to be maintained and indeed needs to become permanent 625 public health nurse positions for our schools. Nurses in hospitals share with us the dangerous circumstances they work under COVID-19, especially given their understaffing in ICUs and also in ICU transfer units or step-down units. That is why we're asking all parties to mandate a 1-to-1. Let me repeat that, to mandate a 1-to-1 RN to patient ratio in ICUs. This is what we had pre-pandemic. This notion in the pandemic that RNs can work, RNs that are expert, they have a certificate in ICU, that they can work with extenders. Well, I will recommend that you read the column of a marvelous physician from UHN that wrote over the weekend her experience as an RN extender and how difficult and almost impossible was. And at the end, she ends, I hope I was some help for the nurses, but we need them. We need those RNs with the expertise, and we need them in the right proportions. So 1-to-1 RN to patient ratio in ICUs and 1:2 RN to patient ratios in ICU transfer units to ensure proper care for ultra-complex and unstable patients, as well as to decrease the burden on our healthcare workers. Simply said, it's unsustainable, and those nurses also left in significant numbers. It will take time to recover from the impact of COVID-19, no doubt. Thousands of individuals have had their surgeries, treatments, and diagnosis test delays or canceled because of the pandemic. Some of it was foreseeable, some of it is due to other reasons of unvaccinated persons that ended up in ICUs or ended up in step-down units. This backlog could take more than 3 years. As you know, it has been called now catastrophic backlogs on surgeries. To increase this situation, we are asking that the surge funding and staffing to safety must be maintained so that we clear the pandemic-induced surgical and diagnostic backlogs and safe discharge from hospitals. Access to mental health also has been a challenge pre-pandemic, exacerbated even more with the pandemic. But we want to focus also on children suffering the mental health challenges and the youth. One aspect of it is what I already mentioned, the 625 nurses in our schools. No doubt they will help children in school to cope with what was 2 very difficult years during the pandemic for them and will continue to be for a while. But other issues like bullying, like drug use in schools, like challenges, other mental health challenges, the anxiety that came from the pandemic, those 625 permanent RNs in schools will help also with that. But we also need to fix the wait times for children and youth mental health services by less than 30 days to stop the skyrocketing hospitalization rates for young people and to address the backlog on these essential services. Children don't have a voice of their own. Parents many times are challenged to advocate. We are calling on the next government to ensure that children do not wait more than 30 days for the services they need, if they need hospitalization, and that services in primary care, services in the schools like the nurses I just mentioned, be put on board so less children actually end up needing hospitalization. We also need to ensure that all parties respond to the toxic drug overdose crisis that is claiming far too many lives. The silent pandemic that we had during COVID is the pandemic of the opioids crisis that was exacerbated. It was a tragedy for families and for the many loved ones that we lost in our communities. So we are asking for support to funding overdose prevention and supervised consumption sites. As you know, we have been asking for that for a long time. We have not even met the ones that were supposedly to be delivered during this 4 years period, but we are asking more. We want every single community that needs an overdose prevention and supervised consumption site to have such a site. It's for the communities to decide what's their crisis, and it's for the communities with the provincial government, and of course also federal government, to make sure that communities have the services and we lose less lives. Every single life leaves a family and a community in pain. Supporting safer supply programs is a must, and decriminalizing simple drug possession is also a must. And we joined the Toronto Public Health Unit in asking that we absolutely decriminalize simple drug possession. Everything mentioned so far will help to an integrated Ontario health system, and this is what we want to talk last. We need to enhance the system integration that was begun by Minister Elliott prior to this pandemic. Minister Elliott, as you remember, launched the Ontario Health Teams. There are 50 integrated such health systems in Ontario, and we believe that we need to fast track their increase in communities where there is no OHTs or other names if a future government, if it's a different government, decides to call them whatever name. Integrated health systems are important for Ontarians. They worked during the pandemic and they will work in the future. But we do have a caveat. During the pandemic, we retrieved back to not primary care anchored. We need to ensure that these Ontario health teams are anchored in primary care, supported by community care, because that is where people live, and that is where we require the strengthening for a well-functioning system so that hospitals do what hospitals do best, and the community maintains people in their communities as long as possible and as healthy as possible. Making sure nursing homes are incorporated into these integrated health systems is important, so that nursing homes have a view, long-term care homes have a view of a home, not of institutionalized care, because people come usually from a home to a nursing home. So let's make sure that that happens. Providing access to non-urgent care within 24 hours, 7 days a week, by expanding interprofessional models of care, as many now are: community health centers, nurse practitioner-led clinics, family health teams. Let's expand them and let's make them 24/7 so that we will decrease the need for people to go to emergency rooms. Locating Karen's care coordinator in primary care. You have heard us say this before, 4,500 of them. They need to be working within Ontario health teams, and they need to be working within home care and primary care. Providing every Ontarian with access to their own personal record. My gosh, people that own and are fortunate enough to be able to have, the plastic card called Visa or MasterCard or whatever, and not everybody has the privilege to have those because of the low income they have. But those that have, and everybody else, including those that don't have, why is it not possible at this time to own our own card with our personal record and have access to it, so that we are not challenged all the time by trying to repeat the story 20,000 times? Implementing a universal single-payer pharmacare has been a motto of RNAO for decades, and the time has come. It is expensive not to have a single-payer pharmacare. And in fact, Canada is the only country that doesn't have it, and Ontario is lagging even more behind. Expanding government-funded oral health is a must for low-income Ontarians. The health of our teeth is the health of our body. It makes no sense not to have a government-funded oral health program for low-income Ontarians. These are the recommendations that we have presented, some of them before, and some of them are new. They are all doable. They are all urgent, and there is no reason why to say this one yes, this one no, because we can pay for it. So let me talk for a second about fiscal capacity. Our provinces currently collects, hear this, the lowest amount of revenue as a percentage of GDP compared to any other provinces. I will repeat, we collect in Ontario the lowest amount of revenue as a percentage of the GDP compared to other provinces. That is wrong if we really want to serve all Ontarians to safety. Ontarians also rank among the lowest in program spending as percentage of the GDP. So let's not think we are spending too much in healthcare, in social services, in environmental health. No, we are not. We need to do that, and in fact, we need to do it more. By providing fiscal capacity, Ontarians can create a healthier society for everyone. To tackle these issues, We are asking to simply implement progressive taxation to better fund essential healthcare, social and environmental services. So what nurses are asking, what RNAO is asking is, let's care for everybody and let's not leave anyone behind. Nurses care deeply about our patients, and we are unwavering, as we've shown during this pandemic, to the care of our patients. We care about the health of Ontarians in health and in illness. And in fact, we want to help keep Ontarians healthy, but we will be there also if they need us during illness. And we care about improving health for everyone. This is why we urge politicians of all parties to accept the policy recommendations of RNAO. We encourage everyone to review our policy platform in detail, and our recommendations are, in our view and in the view of the nurses of Ontario, the path forward. Thank you very much, and we will open now for reporters first to questions, and then after reporters, if we have time, also for other members that are present today, given the excellent numbers of people that are attending. Close to 100 people, so let's go for it. Marianne, are you monitoring the media or one of my colleagues?
Yes, we have members of the media present. If you have a question, please go ahead.
Are there mics on mute or not? Because I can't see.
It's I'm not seeing anybody who has their hand up, Doris. So nobody has their, but if somebody does have a question, you can find the raise hand feature and put your hand up. And if you can't find that, then please feel free to unmute yourself and ask your question.
And I will take, meanwhile, a second to tell the media that they're welcome to come this afternoon. Marianne, you will remind me at what time we start with the politicians, I think at 4?
3 p.m., Doris.
Sorry, at 3 p.m. Here you go. So any media person that wants to join during the leaders of all the parties, please, and the Minister of Health and Minister of Long-Term Care also, please join us. You are welcome. During the conversations with the politicians, though, we need to tell you we reversed the order. So now is your chance to ask questions, because when the politicians come, the first chance goes to members of RNAO and then to the media. So now is your chance for the media first. Okay, so any members or any other person from other, I think we have a nurse candidate. I see Anna Cole also. Yes, you can. No, we cannot hear you, Anna Cole. Now, yes.
I'm sorry, there's a lot of construction going. I mean, we had something in our house, but anyway, my question is, could you please elaborate on this pharma care program that you talked about, Doris?
Yes. So all the OECD countries, Anacul, have what's called universal pharmacare. You see, in Canada, the situation is quite peculiar. If you are in a hospital, your drugs are free, right? Whatever antibiotic, whatever expensive or non-expensive medication that you need, you don't pay for it, right? But the moment you leave the hospital, if you do not have a program, or unless you are very low income and then you can access some funding, the rest you need to have insurance. It's not covered for you. Some of the drugs are, if you are in antibiotics and you go to a primary care physician, some are not. but not all drugs, not all medications are covered universally for Canadians and for Ontarians in particular. So we are asking that we want a universal single payer, meaning government, right? Because it's cheaper when it's government run, when it's universal versus different types of insurances or etc. That's a lot more expensive from an administrative perspective. So we want a single payer, universal pharmacare program, which means any medication that you need, whether you are in the hospital, whether you are in home care, whether you don't have home care, you don't need home care, but you are going to primary care, that all medications that you are asked to take because you need them, that they be covered by the universal insurance. Does that help? And we are the only country on OECD countries that doesn't have universal access to pharmacare.
Thank you, Doris. Thank you.
And we will be delighted to send you. We have a long background there on that. I think you will enjoy reading that too.
Definitely. Thank you so much for that. Just a follow up. Will this program be at a federal level, or will that be at a provincial level? Because
I was saying before you joined, I was saying to Marianne that you have so always very, very, very thoughtful questions. And I have said this before to you. I am saying it again. So it can be, ideally, yes, will be lovely if it's federal for the entire country. And I will comment on that in a minute, not related to this press conference, but related to the federal budget that is coming up and what we are asking there, Anukul. But related to Ontario, we did have a program in Ontario that started with the previous government that had components of it and was put on hold by the current government. There are many things, Anukul, that we do not need to wait for the federal government. Even Medicare, this universal access to healthcare that some of us didn't have in our countries before we came here, including me and you and others, that started in Saskatchewan with a premier at the time called Tommy Douglas, and he started it in Saskatchewan, and then it moved federally. So why not to have Ontario, Anukul, to actually play a role in leading a universal access pharmacare program here in Ontario, and then people will remember for decades and for centuries after that, hey, that one started in Ontario, and the feds didn't have a choice but to pick it up. You know what I mean? So there is a lot that we can do here in Ontario to lead the rest of the world. Let me give you another example where this has happened in Ontario, nurse practitioner-led clinics. We started them in Ontario, and then now you see them in the country. The nursing graduate guarantee that started in Ontario, we are seeing that in the country now. So we are saying, let's do the same with universal pharmacare.
Thank you.
Does that help, Anukul?
It does. Thank you so much.
Thanks, Doris. I don't see anybody else with their hand up. We do have a couple of questions in the chat. If there's anybody else from the media, this is your last chance to get your questions in. I do want to remind you that our media conference today does just go till 11:30. If there's any questions that remain unanswered that are from our members, we'll make sure that they get covered in our afternoon session as well. So still not seeing any hands. So the first question's from Bridget, which is around, has RNAO collaborated with CNO's program approval folks to support RNAO's recommendations to compress RPN to BSEN bridging programs to 2 years in length?
So I can mention that we have brought that to Joint Provincial Nursing Committee. And we also have brought the issue of recognizing, we used to have in Ontario and many parts of Canada, what's called prior learning assessment. So if you were a PSW for many years and you were excellent and you did courses, etc., or if you were an RPN and you did courses, etc., and you also had clinical experience for many years, that some of that be recognized as prior learning assessment towards the next degree. So, and by the way, we are not saying that a PSW needs to go only to RPN. We have an excellent example, Diana, that is actually was a PSW, and now she's enrolled, bravo, at Ryerson as for the RN program. But we are saying, yes, it needs to be compressed, and we do need to recognize prior learning assessment. And the other piece to that, Brigitte, is the issue of bridging programs that are flexible, so that many people need to continue to work, especially newcomers to this country, some single mothers, some single fathers, that if they are a PSW, they need to continue to work. If they are at RPN, some need to continue to work. So let's make those programs more flexible so people can continue to work if need be, and also attend the courses towards the next degree. I hope that helps.
Thank you, Doris. The next question is from Janet Hunt, and it's around, can you elaborate on whether there is a focus on chronic care or the provision of complex care within the community as part of the platform?
So you want to take a stab? You want me to take a stab?
Sure. Yeah, so I would say, so although it's not specifically in there, it would be part of the seniors care strategy. So recognizing that not all people who need chronic or complex care within the community are seniors. There is a focus on, as we move forward with the extended hours and towards the 4 hours of care in the community, also advocating for the 4 hours of care within long-term care, also advocating for those 4 hours of care to be available for people who need them in the community. So although it's not explicitly within the policy platform, there would be advocacy work and recommendations to align the hours of care that residents in long-term care can access with the hours of care that individuals who live in the community and in their own homes in the community would be able to access as well. Anything to add, Doris?
I think it's an excellent capturing of what we have. Only to add to it that we are asking for increased funding for home care. So whether that will be for chronic care or whether that will be for post-surgical recovery, that's where also the Ontario health teams or integrated models of care can play a critical role. Absolutely, yes. And the other piece, Janet, to augment what Morgan is saying, is that we are saying that the first visit should be an RN. And in part it's because of that, right? When a person requires home care, or when a person requires home care because he's discharged from hospital, regardless of the circumstances, the first visit, if it's done from an RN, then you can do the comprehensive care and then triage it. And of course, we know that RPNs, RNs, NPs, CNSs, everybody have a critical role to play on chronic care. And so do people, quite frankly, from other professions, So do people from other professions, whether it is a person that needs to do home cooking, or people with chronic care may need the assistance to go to do shopping. Like, we are very boxed, I think, in the way we think, but when you look at the ECHO model from which some of these recommendations about strengthening community care came about, we need to expand our horizons so we can indeed keep people with chronic conditions at home, rather than basically they move sometimes to another setting simply because they didn't have the right support. So thank you for raising that, and please do connect with us and let us know how else we can augment that with your expertise. Thank you.
Thank you. The next question is from Maria Rugg. So it's asking if you can please speak to the issue of the bonus payments to nurses and how this does not address Bill 124.
Well, Bill 124 is salary compression, right? It's basically suppression, right? It can't do anything. So it is completely delinked in a way from Bill 124. So those are two things that need to happen that we have been asking for quite some time. One is do away with Bill 124. And I have a bet with several people, so I need to win that bet too. So here you go. That's one piece. And then though, even if Bill 124 or when Bill 124 will be repealed, still there will take time until our colleagues, whether it's ONA or CUPE or another union, will do their labor negotiations, whether if we are lucky it's 3 months or whether it extends to a year, you know? So we are saying top up the compensation right away. If not, we will continue to bleed RNs, in particular RNs, out of the system. So the $5,000, I mean, I don't want to not recognize it because, you know, it's a good gesture, it's a good intention, it shows goodwill, right? That there is a beginning listening to the pain, quite frankly, of nurses. That if you remember during the first and second wave, everybody got RNs, RPNs, PSWs. They all got $4 an hour, if I recall, top up to their compensation. That didn't happen in the third, fourth, and fifth, and who knows if there will be a sixth wave. You know, so the $5,000 is less than what PSWs got already. If you do the taxation to that, I again don't want to be crushed or not recognizing the intent of it. So it is a good intentions. It is a show that there is a beginning listening, but it needs to be much more significant than that.
Thanks, Doris. There's not any other specific questions in the chat, but some comments around how salary discrepancies continue between RNs in hospitals and outside of hospitals, with about between a $10 to $15 an hour difference.
So that is in our platform. Just so you all know to the person that put the question, we are actually asking salary harmonization, and by the way, harmonization up, not down. So not to the sector that is paying less, but harmonization up for all the ends within their categories, for all RPNs, for all, etc. Yeah, that is an excellent point. And the colleagues in community care and in primary care, by the way, they know that many of them have, as we say always, one leg here and one leg there. You know, because of the issue of compensation rather than where their heart is. And for some, the heart is in an ICU or in an emergency department. For some, the heart is in primary care. For some, the heart is in home care. But let's make sure that the money follows the heart in the same way for all sectors. So well said to the colleague that raised the issue.
That was from Dr. Paul-Andre Gauthier. As well, we have some comments around the role of from Paul-Andre about the role of the clinical nurse specialist and how important it is for individuals who require complex care. And some other comments around how many seniors in the community, home is where they want to be, especially with all the media attention around long-term care, and additional comments around how people in the community aren't receiving anywhere near the 4 hours of care, particularly the younger patient population, so the 18 to 65-year-olds who get forgotten when they have medical or mental health issues. And sorry, that's as far. There's a lot of new comments now that I have to read to stay caught up. Comments around how some people weren't included, from Dr. Cooper Brathwaite, about how some people weren't included, specifically police services in the
Bill 124. So police, firefighters, and doctors.
And MPPs.
Well, and MPPs were not included. And the reality is, you know, nurses should have never been included. We are an essential service. You know, we are by law an essential service. That's why nurses cannot, for example, strike. So nurses should have never been included, but the reality is the day this pandemic started, in our view of RNAO, that bill should have been repealed because also teachers had a difficult challenge during a pandemic. Other people that are in unionized or in public service positions, everybody had a challenge during the pandemic. So Premier, a message for you, and I think you're coming to see us at 6:15. So that's the place where you can make the announcement.
It's we have 2 minutes left, and there's one last question from Kathy Moreland around, is there anything in the platform to address the upcoming and current shortage of qualified nursing faculty to help educate all the new nurses that we will need?
So yes, we do. We do have in the platform, and we also have in the budget, as you know, Kathy, from the Nurses and Wellbeing Survey, which, by the way, May 12th, there will be the release of a comprehensive report about nurses' health and well-being that will incorporate 3 surveys this time, including one international and one national, plus the one we did here in Ontario. All of them we were involved or led. And one of the big hemorrhages of nurses is in faculty positions, Kathy. So yes, we are looking into that significantly. And the other is, by the way, in senior management positions, and I'm referring mainly about chief executives, etc. So a lot of work to do, and some of that we have initiated already, and you will see also in that report specific programs towards that. We welcome your input also.
Thank you, Doris. It's now 11:30, which means we need to wrap up. So I believe you have some closing remarks, but I am looking forward to seeing all of our members and anyone else who wants to join us later on, starting at 3 o'clock today for Queen's Park Day. And
I would give it to you, Madam President, and to my President-elect. And if someone can put the camera to our immediate past President, Dr. Angela Cooper-Brathwaite, I leave the 3 of you to say the thank yous, starting with you, Madam President.
Well, thank you. So thank you so much to all of our members, to the members of the media, members of the public who joined us today for this really important policy platform release. Every time we have an election, I always am really excited to see what RNAO is asking for, and then feel hopeful about all of our political parties adopting these recommendations into their policy platforms, because as we all know, this is what will make a significant difference to the healthcare system and to the health of Ontarians. So thank you so much for joining us. Thank you to the RNAO policy team and communications team, and to Doris for putting all of this together. And then we'll go to Angela.
Thank you, Madam President, and it's an honor. I just like to thank the media for their attendance and to share our platform information with the people of Ontario, because we need the broader sector to be involved. They have to make wise decisions as they prepare to vote in June. So thank you for your attendance. Thank you for sharing our stories. Thank you to our CEO, past President-elect, current president, and former past president, members of the board, and RNAO staff who are so energetic and working to make this such a fruitful event. Thank you so much.
Thank you.
Claudette.
So thank you for all what has been said so far. I would like to add to that there is hope. There's hope because RNAO is on the case. We have the platform. We encourage you to participate this afternoon again and to spread the word, get the word out to the public. The media can help us do that, because this year in particular, health and our health system includes everyone. We need to make that very clear to all our parties. Thank you.
And I want to say something now that I heard all of you ladies, because we didn't plan for this way. We didn't even practice for this way. But what you heard from our current president, Morgan, you need to go with your right hand. Okay, we tweeted her because the way she's smiling always, even when she boo-boo her hand, and our immediate past president and our president-elect, you know, staff and CEO can only be as courageous as the board of directors allows that person to be. So the thank you goes to you guys, to the members, to the Assembly of Leaders. We look forward to seeing you, and thank you for being a courageous organization. We need that more than ever. Thanks. And to Claudette's point, yes, there is hope, big time. We can make it happen. It's solvable. This is what everybody needs to remember. No hands up. It is solvable, and together we can solve it. This concludes our remarks, Marianne. And here is in case that anyone in the media is still there or taping. Sometimes they're taping. Please feel free to call our amazing Director of Communications, Marianne Zich, or Madison Skaney for interviews or media inquiries, or for the platform, go to the website. See you this afternoon.